The first time it happened, Tom thought Sarah was choking. He woke to a sound like someone stepping on a ripe plum, thick and wet and sudden. Sarah was next to him in bed, on her back, and her mouth was open. Not the way a mouth opens during sleep. Not a snore, not a yawn caught halfway. Her lower jaw had dropped straight down, the hinge gone slack, and the opening was wide enough that Tom could see past her teeth, past her tongue, into the dark tunnel of her throat. The skin around her lips was white and stretched taut, pulled to its limit. She was still asleep. He grabbed her shoulder. "Sarah, Sarah, wake up." Her eyes opened and she made a sound that wasn't a word, a garbled nasal whine, pushed through her nose because her mouth was locked open and couldn't shape it. Her hands came up to her face, touched her jaw, and her eyes went wide. She tried to close her mouth. It didn't close. Tom called 911. The paramedics arrived in 12 minutes and found Sarah sitting on the edge of the bed with tears running down her face and her jaw hanging open like a broken door. They stabilized her neck, loaded her onto a stretcher, and took her to St. David's. In the ER, a doctor named Womack manipulated the mandible back into its socket with a technique that involved pressing his thumbs down on her lower molars and pushing backward. The sound it made, a grinding, crunching realignment of bone finding bone, made Tom's knees go weak. "Bilateral mandibular dislocation," Womack said afterward, snapping his gloves off. "It's not rare. The condyles slipped forward out of the temporal sockets. Could be caused by extreme yawning, connective tissue disorder, or sometimes it's just bad luck." "She was asleep," Tom said. "She didn't yawn. She was lying flat on her back, and her jaw just opened." Womack nodded the way doctors nod when they hear something they don't have an explanation for but aren't going to admit it. He prescribed cyclobenzaprine for the muscle spasms and told them to follow up with an oral surgeon if it recurred. Sarah held an ice pack to her jaw in the passenger seat on the drive home. She didn't speak until they were pulling into the driveway. "Something pushed it open," she said. "What?" "My jaw. It didn't just fall open. Something pushed it. From inside." Tom looked at her. The bruising was already starting. Dark smudges along the line of her jaw, blue and purple against her pale skin. Her mouth was swollen, the corners cracked. She looked like she'd been hit. "The doctor said it could just happen sometimes," he said. "The doctor is wrong." She went inside and sat in the living room and didn't say anything else for the rest of the morning. Tom made breakfast for the kids, Jake, 10, and Lily, 7, and told them Mom had a dental emergency, nothing serious. Jake accepted it. Lily wanted to see. Tom said no. 2 days passed, normal days. Sarah's jaw was sore but functional. She ate soft foods, took the muscle relaxants, moved carefully. The bruising faded from purple to yellow-green. Tom watched her while she slept. He didn't mean to. He'd lie in bed and realize he was staring at her face in the dark, watching the line of her jaw, waiting for it to drop. It dropped on Tuesday night. The same wet pop, louder this time, like a knuckle cracking amplified through a microphone. Tom was awake instantly. He turned on the lamp and Sarah was on her back with her mouth open wider than before. Significantly wider. The lower jaw had dropped so far that her chin was nearly touching her chest. The opening was enormous. A dark, glistening cavity that showed everything. Teeth, tongue, the ribbed roof of her palate, the dangling bulb of her uvula, and beyond that, the contracting walls of her throat. The skin at the corners of her mouth was stretched to the point of translucency, the tissue paper thin and faintly blue where the veins showed through. Her eyes were open. She was awake and she was looking at Tom, and she couldn't speak. And the look on her face was not pain. It was confirmation. The look of someone who told you something was going to happen, and now it was happening, and she wanted you to see it. The ambulance, the ER, a different doctor this time, younger, less certain. He called in a colleague. They conferred in the hallway in voices they thought Tom couldn't hear. He caught fragments. Degree of displacement. No underlying pathology. Connective tissue panel. This wide is unusual. They reduced the dislocation. It took 2 doctors this time, working in tandem, one on each side of the mandible. The sounds were worse, a sustained, grinding protest of bone against bone, cartilage popping, Sarah screaming through her nose because her mouth was a fixed aperture that wouldn't close until they forced it. When it was over, the younger doctor sat down with Tom in the hallway, while Sarah was sedated in the exam room. "The corners of her mouth have micro tears," he said. "The tissue is starting to suffer. If this happens again with the same degree of displacement, we could be looking at significant soft tissue damage." "Why is it happening?" "We don't know." The connective tissue panel came back normal. There's no joint erosion, no structural deficiency. Frankly, the degree of opening doesn't make mechanical sense. The mandible shouldn't be able to displace this far without fracturing. But it did. Yes, it did. They went home. Sarah slept in the recliner in the living room from that night forward. She told Tom it was because the recliner supported her head better. The real reason, which they both understood and neither said aloud, was that she didn't want the kids to hear her jaw break open at 3 a.m. Tom called an oral and maxillofacial surgeon named Petrov. Russian, older, practiced for 30 years. He could see Sarah on Friday. Tom described the situation over the phone, and Petrov was quiet for a long time and then said, "Bring the imaging from both ER visits." Friday came. Petrov examined Sarah's jaw with the calm, methodical focus of a man who had seen a lot of broken faces. He palpated the joint. He measured the range of motion. He reviewed the ER imaging on his screen, switching between the 2 visits, comparing displacement angles. "The second dislocation is approximately 30% wider than the first," he said. "That's not consistent with a recurring mechanical failure. In a normal recurrent dislocation, the degree is similar each time because the anatomy hasn't changed. This is escalating." "What would cause it to escalate?" Tom asked. Petrov didn't answer directly. He turned to Sarah. "You told the ER staff that it feels like something is pushing the jaw open from inside. Can you elaborate?" Sarah had been sitting very still on the exam chair, her hands in her lap, her face composed in a way that Tom recognized as effort, the deliberate maintenance of calm over a current of fear. "It starts in my throat," she said. "A pressure, like something heavy sitting on my esophagus, pushing upward. Then the jaw goes. It's not the jaw that's the problem. The jaw is just making room." "Making room for what?" "I don't know, but it's getting bigger. I can feel it when I swallow. It's harder to eat. There's something in there." Petrov put on gloves and asked Sarah to open her mouth. She opened it, carefully, 2 inches, wincing. He angled a penlight into her throat and looked. Tom watched Petrov's face. The surgeon's expression didn't change, but his hand stopped moving. The light held steady on one point for 5 seconds, 10 seconds. "I'd like to do a CT scan," Petrov said, straightening up. "What did you see?" "I want to confirm with imaging before I speculate." The CT scan was the next morning. Sarah lay on the table and disappeared into the machine, and Tom sat in the waiting room and stared at the wall and tried not to think about the look on Petrov's face when he'd shone the light into Sarah's throat. The look of a man who had seen something that didn't belong. Petrov called that evening. He asked them both to come in Monday morning. Monday. Petrov's office. The CT images on the screen. Tom saw it and knew immediately that nothing about their lives was going to be normal again. He didn't need a medical degree. The thing on the screen was obvious. A bright, dense mass lodged in Sarah's upper esophagus, 6 inches below her tongue. It had edges, crisp, defined geometric edges, straight lines meeting at angles that looked intentional, deliberate, designed, not the lumpy, irregular blob of a tumor, not the smooth oval of a cyst, something with structure, something that looked, against all reason, like it had been built. The density is consistent with calcified tissue, but the morphology doesn't match any biological structure I've seen, Petrov said. Tumors don't have 90-degree angles. Bone doesn't grow in flat planes. This is something else. What kind of something else? Sarah asked. Her voice was flat. She'd been expecting this. She'd felt it growing. I don't know. I've sent the images to 3 colleagues, an oncologist, a radiologist, and a specialist in esophageal pathology. None of them have been able to identify it. Petrov pulled up the X-rays from Friday alongside the CT from Saturday. He measured the mass on both images. Friday, 2.6 centimeters. Saturday, 3.0 centimeters. 4 millimeters of growth in 24 hours, he said. Whatever this is, it's active. He recommended surgery, endoscopic removal, down through the mouth, extract the object, examine it. He wanted to schedule it within the week. Thursday, if the surgical team was available. Is it dangerous? Tom asked. The surgery? The procedure itself is straightforward. What concerns me is the nature of the object. I can't predict what we'll encounter when we attempt removal. It may be embedded in the esophageal wall. It may have its own blood supply. I want to be prepared for complications. Thursday. They had 4 days. On Tuesday, Tom woke at 2 a.m, and Sarah was not in the recliner. He found her in the kitchen, standing in front of the sink, her head tilted back, her mouth open, her phone's flashlight balanced on the counter and aimed upward into her throat. She was looking at the ceiling, but she wasn't seeing the ceiling. She was somewhere inside herself, focused on whatever she was feeling in her throat. Sarah. She lowered her head slowly. Her eyes found his. It moved, she said. It's higher now. I can feel it behind my tongue. Tom looked into her mouth. In the white beam of the flashlight, past the arch of her palate, in the dark recess of her throat, he could see something. A shape. Angular, dark, glistening with saliva. Just the tip. The topmost portion of whatever was lodged in her esophagus, now visible at the base of her throat. It had the dull, wet sheen of something inorganic. Something that had no business being inside a human body. Can you breathe? Tom asked. Mostly. It's harder when I lie down. It shifts. We need to go to the ER. They can't do anything. They'll take an x-ray and see it and want to schedule the same surgery Petrov already scheduled. We wait until Thursday. She was right in the most practical sense. She was wrong in every other sense. But Tom didn't push it because Sarah had entered a state of determined endurance that he recognized from childbirth, from the time she'd broken her collarbone falling off a ladder, from every crisis he'd seen her face in 14 years of marriage. She would manage the situation with discipline and composure until the solution arrived on Thursday. And she would not be talked out of this approach by anyone, including him. Wednesday, the day before surgery, Tom took the kids to his mother's house, told them Mommy was having a small procedure, nothing to worry about. Jake asked if it was her jaw again. Tom said yes, sort of. Lily drew a picture for Sarah, a house with a sun and flowers, and asked Tom to give it to her. He put it in his jacket pocket. When he got home, Sarah was in the bathroom. She had the door open and she was gripping the edges of the sink and looking at herself in the mirror with an expression that Tom had never seen on her face before. Not fear, not pain, something closer to awe. The terrible, frozen awe of watching something impossible happen to your own body. Her throat was distended. Visibly, obviously distended. The column of her neck bulging outward on the left side, the skin stretched tight over something solid beneath it. It looked like she'd swallowed a fist. The skin had a faint bluish tint where the blood flow was being compressed, and when Tom put his hand on her neck, gently, barely touching, he could feel it. Hard, angular, warm, warmer than her skin. It had its own heat. "It's been pushing up all day," Sarah said. "It comes and goes, like contractions. It pushes up, then relaxes, then pushes up higher. We're going to the ER right now. Tom." "Right now, Sarah." They drove. Sarah sat in the passenger seat with her head tilted back and her hands on her throat, pressing gently, as if she could hold it in place through force of will. She was breathing through her nose in slow, controlled pulls. The swelling in her neck was visible even in the dim dashboard light. At St. David's, the triage nurse took one look at Sarah's neck and called a doctor immediately. They were in a room within minutes. Dr. Chen, an ER attending with sharp eyes and fast hands, examined Sarah's throat, ordered imaging, and had results within the hour. The mass was now at the level of the hyoid bone, the small horseshoe-shaped bone at the base of the tongue. It had been 6 inches below the tongue on Saturday's CT. In 5 days, it had traveled 4 inches upward. "We can't wait until tomorrow," Chen said. "I'm calling in the surgical team tonight." The next 2 hours were a blur of consent forms and IV lines and preoperative preparation. Tom sat in the surgical waiting area in a plastic chair under fluorescent lights and drank bad coffee and tried to keep his mind from racing through scenarios that all ended with Sarah on an operating table and something going wrong. The surgeon came out at 1:45 in the morning. His name was Alvarado. He was the on-call ENT surgeon, young, confident. He sat down next to Tom and clasped his hands between his knees and took a breath before speaking, which is never a good sign. "We couldn't remove it," he said. "What?" "The object is embedded in the esophageal wall. It's not sitting in the lumen. It's grown into the tissue. It has vascular connections. When we attempted to separate it from the esophageal lining, the bleeding was immediate and significant. We had to abort. So it's still in there." "Yes. We managed to take a small biopsy of the surface. The sample has been sent to pathology." "What is it? Could you see it?" Alvarado paused. He looked at his hands. I've been practicing for 11 years. I've removed tumors, foreign bodies, impacted food boluses. I've never seen anything like this. It's solid. It's angular. The surface has a texture that doesn't resemble any biological tissue I know. Under the scope, it looked almost crystalline, faceted, with a regularity that suggests structure at a molecular level. It's dark, nearly black, and it absorbs light in a way that made it difficult to visualize even with the endoscopic camera. Is it alive? The question came out before Tom could think about it. Alvarado looked at him. Tissue doesn't grow into surrounding structures the way this has, unless it's vascularized and metabolically active. So in a biological sense, yes, it's alive. But it's not a tumor. It's not a parasite. It's not anything in the differential diagnosis that I or my colleagues could construct. What happens now? We wait for pathology. We monitor, and we hope it stops growing. It didn't stop growing. Sarah came home on Thursday with a sore throat and a set of discharge papers, and the knowledge that the thing inside her was staying there because cutting it out would kill her. She sat in the recliner and held the ice pack to her throat and closed her eyes and didn't speak for the rest of the day. The pathology results came Friday afternoon. Petrov called. He asked Tom to put the phone on speaker. The biopsy showed a cellular structure we can't identify, Petrov said. His voice was careful, each word placed precisely. The cells are nucleated, but the DNA doesn't match any organism in the database. Human, animal, microbial, nothing. The lab ran the analysis twice. The cellular architecture is regular and repeating, like a crystal lattice, but with organic components. Lipid membranes, protein structures, nucleic acids, all present, all arranged in a pattern that doesn't correspond to any known life form. Nobody spoke. The speakerphone hissed in the silence. I've referred the case to the university, Petrov continued. They have a research team that specializes in anomalous pathology. In the meantime, we need to monitor the growth. If it continues to ascend, we may need to consider more aggressive surgical intervention, despite the risks. After the call, Sarah sat in the recliner and looked out the window. Tom sat on the couch and looked at Sarah. It's not going to stop, she said. You don't know that. I can feel it. It's not just pushing up anymore. It's doing something, rearranging, like it's getting ready. Getting ready for what? She didn't answer. Over the next 3 days, Sarah changed. Not emotionally, physically. Her neck thickened, the muscles and tissue swelling outward to accommodate the growing mass. She could no longer turn her head fully to either side. Swallowing became difficult, then painful, then nearly impossible. She moved to a liquid diet, broth, smoothies, water, taking tiny sips that she had to work down past the obstruction with deliberate, effortful swallows. She lost weight rapidly, her face thinning, her collarbones sharpening. The worst part was the movement. Tom could see it now without even trying. The thing shifting inside Sarah's throat at random intervals, producing a visible bulge that traveled up and down the column of her neck like something pacing in a cage. It would push up. The throat would distend. Sarah would grip the arms of the recliner and close her eyes and breathe through her nose. And then it would retreat, and she would relax, and the cycle would start again an hour later. Each upward push brought it slightly higher than the last. Each retreat took it slightly less far down. Tom stopped sleeping. He sat in the chair next to the recliner and watched Sarah through the night. He watched the thing in her throat push up and pull back, push up and pull back, patient and rhythmic and relentless. He started to think of it as breathing. The thing was breathing inside his wife. On Monday, 9 days after the first dislocation, Sarah woke Tom at 4 a.m. by grabbing his wrist. He opened his eyes and she was looking at him and her face was wrong. Swollen, darkened, the blood vessels in her cheeks and forehead distended and purple. Her neck was enormous. The mass had pushed up to the level of her jaw and was pressing outward against the skin with enough force to deform the shape of her throat into something that no longer looked human. She opened her mouth to speak, and Tom could see it sitting right there, behind her teeth, filling her throat completely. Dark, wet, angled. "It's time," she whispered. The words were distorted, squeezed around the mass, barely intelligible. "I'm calling an ambulance. It won't matter. Sarah, get out of the house. Take the car and go to your mother's. Get the kids and drive somewhere far away. I'm not leaving you." Tom. Her hand tightened on his wrist. Her grip was stronger than it should have been. Much stronger. The fingers pressing into his skin with a force that felt mechanical rather than muscular. "It's not going to come out and just lie on the floor. It's coming out because it's ready. And when it's out, it's going to need things. Do you understand? It's going to need things. And I can feel what it needs. And you have to not be here." Tom looked at his wife. The woman he'd married 14 years ago, who laughed at bad jokes and burned rice and sang off-key in the shower and loved their children with a ferocity that scared him sometimes. She was in there, behind the swollen face and the bulging throat and the dark thing sitting behind her teeth. She was in there, and she was telling him to go. He didn't go. He should have gone. At 4:22 in the morning, Sarah's jaw opened for the last time. The sound was different this time. Not a pop, not a crack. A sustained, wet tearing. The sound of connective tissue separating from bone, of ligaments snapping under forces they were never designed to handle. Sarah's mandible didn't dislocate. It broke. Both condylar necks fractured simultaneously, the thin bridges of bone snapping like dry twigs, and the lower jaw dropped free of the skull entirely, held in place only by skin and muscle, and the thin web of fascia that connected it to the rest of her face. Her mouth opened to a width that was no longer a mouth. It was a wound. A vertical split that ran from below her nose to the middle of her neck. The skin tearing at the corners in slow, wet lines that climbed upward toward her cheekbones and downward toward her collarbones. Tom could see the tearing happen, could see the individual fibers of skin separating, the dermis pulling apart strand by strand, the subcutaneous fat bulging through the widening gaps like foam pushing through a crack. Blood ran in sheets down both sides of her face, streaming over her ears, pooling in the hollows of her collarbones, soaking into the fabric of the recliner. The mandible swung loose, a horseshoe of bone dangling by tissue, the fractured condyles visible as white splinters poking through the torn muscle at the hinge points. Her teeth were fully exposed, upper and lower, the gums retracting as the skin pulled away. He could see every filling, every root, the pink wet architecture of her mouth laid open to the air. Her tongue lay flat at the bottom like something stranded, thick with blood, twitching. Tom was screaming. He was standing 2 feet away, and he was screaming, and his hands were reaching for her, and he couldn't bring himself to touch what her face had become. The lower half of Sarah's face had folded open like a hatch, and what was underneath was red and wet and glistening, and it didn't look like a face anymore. It looked like a passage, a doorway made of flesh, being held open from the inside. The thing came up. It emerged from Sarah's throat the way a hand emerges from a glove, slowly, smoothly, with a slick, lubricated precision that suggested it had been designed for this. Designed to pass through a human throat, to open a human jaw, to use a human body as a passage from wherever it had been to wherever it was going. The first portion visible was a narrow, angular protrusion, like the prow of a ship, sharp-edged and dark, coated in a film of mucus and blood. It pushed past the ruined hinge of Sarah's jaw and into the open air and kept coming. Behind the prow was a wider section, flat and faceted, that stretched Sarah's throat to the point of translucency as it passed through. Tom could see veins through the skin, blue and straining, could see the outline of the thing pressing against the inside of her neck, like a shape under a bedsheet. He could hear the sounds of her body yielding to it, the wet, crackling shift of cartilage being displaced, the slow tearing of tissue that couldn't stretch far enough, the gurgling of fluids being pushed out of the way. Her trachea was being crushed sideways. Her esophagus was splitting along its length to accommodate the widest section. He could see the bulge traveling up her neck like a snake swallowing in reverse, the skin distending grotesquely, the blood vessels on the surface popping one by one, tiny red starbursts appearing across her throat, like a constellation of hemorrhages. Sarah's body was shaking, a whole body tremor, not convulsions, a vibration, as if the frequency of the thing coming through her was resonating with her bones and her muscles and her skin. Her hands were limp at her sides. Her eyes were still open, still locked on Tom, but the light in them was fading, not dying, receding. Something pulling her awareness inward, away from the surface, away from him. The widest part of the thing passed through her jaw, and her throat visibly contracted behind it, collapsing inward like a tunnel after a cave-in. Blood ran freely now, from her mouth, from her nose, from the torn corners of her face. It sheeted down her neck and soaked into her shirt and pooled in the hollow of her collarbones. The smell was copper and something else, something mineral and cold. The smell of the thing itself mixing with the smell of her blood. It was dark, not black, a darkness that seemed to exist independently of the light in the room, a surface that took in the lamp glow and gave nothing back. The texture was regular, geometric, covered in patterns that looked almost like writing. Tiny, precise markings etched into the surface in rows and columns. They caught the light at certain angles and refracted it into colors that Tom didn't recognize. Colors at the edge of the visible spectrum that made his eyes water. The thing was 18 inches long by the time it cleared Sarah's mouth entirely. It hovered for a moment, actually hovered, suspended in the air above her ruined face, oriented vertically, dripping. And then it moved. Not fell. Moved. With direction and intent, the way a living thing moves. It drifted sideways, away from Sarah's body, and descended to the floor, and stood upright on its narrow base, and was still. Sarah's body collapsed backward in the recliner. Her head lolled, her destroyed jaw hanging open, her throat a hollow tube of stretched, bruised skin. Her chest was moving, barely, shallowly, but she was breathing. She was alive. The thing had left her alive. Tom was against the far wall of the living room. He didn't remember moving there. His back was pressed against the plaster, and his hands were flat at his sides, and he was staring at the object standing on his living room floor. It was about 2 feet tall, narrow, angular, and it was vibrating. A low, sub-audible hum that Tom felt in his teeth and his sinuses and the base of his skull. The hum of something powering up. The thing unfolded. There's no other word for it. The angular surfaces of the object separated along seams that hadn't been visible, splitting apart and reconfiguring, pieces rotating and extending and locking into new positions. It was like watching origami in reverse. A compact shape expanding into something larger and more complex, each fold revealing new geometry that had been hidden inside the previous form. The movement was fluid and mechanical at the same time, organic and precise, and the sound it made was a series of soft, wet clicks, like knuckles being cracked in sequence. The unfolding took about 30 seconds. When it was done, the thing was no longer a compact object. It was tall, nearly 6 feet, and vaguely humanoid in shape. 2 vertical structures that might have been legs, a central mass that might have been a torso, 2 lateral extensions that might have been arms, and at the top, a shape that might have been a head, except it was featureless. No eyes, no mouth, no detail. Just a smooth, dark ovoid that radiated the same hum as the rest of it. It stood in the living room of Tom and Sarah's house, and it turned, the ovoid rotating smoothly on the central axis of the body, and it faced Tom. He ran. Out the living room, down the hall, through the kitchen, out the back door. He ran across the yard and over the fence and into the Hendersons' backyard, and he didn't stop running until he was in the street, 3 houses down, standing on the asphalt in his bare feet and boxer shorts at 4 a.m. He stood there gasping. The street was dark and empty. The houses were dark. The world was quiet and normal, and sleeping, and somewhere behind him, in his living room, something impossible had just crawled out of his wife's throat. He called 911, told them his wife was hurt, gave the address, didn't mention the thing because he didn't have words for it, and because they would think he was insane. He waited in the street for the ambulance. It came in 8 minutes. He followed the paramedics back to the house. The front door was still closed, the way he'd left it. The lights were still on. Everything looked normal from outside. They went in. The living room was empty. The recliner was there, the blanket was there, a smear of blood on the headrest. But Sarah was gone. The thing was gone. The only evidence that anything had happened was the blood on the recliner and a thin, dark residue on the carpet where the object had stood. A stain shaped like a narrow oval, roughly 6 inches across, that glistened faintly under the overhead light. Tom told the paramedics that his wife had been in the chair, that she was injured, that he'd gone to call for help, and when he came back she was gone. They searched the house. They checked every room, every closet, the garage, the yard. Nothing. They called the police. The police came, took a statement, searched the house again, searched the neighborhood. Nothing. Sarah was gone. Tom sat on the couch in his living room at 5 a.m. and answered questions from a detective who was trying to be patient and was clearly leaning toward a domestic violence narrative. Tom didn't blame him. Husband calls 911, says wife is hurt. Wife disappears. The simplest explanation is usually the right one, and the simplest explanation here was that Tom had done something to Sarah and made up a story. But there was the blood. The paramedics had documented it. Arterial spray on the headrest, pooling on the seat cushion, quantity consistent with a significant facial injury. And there was the residue on the carpet. The detective had an evidence tech swab it. It came back as an unknown substance, organic in composition, but not matching any bodily fluid in the reference database. They let Tom go. They didn't have enough to hold him, and the blood evidence wasn't inconsistent with his story about a jaw injury. He went to his mother's house. He sat in the kitchen while his children slept in the guest room and his mother made coffee. She knew he wouldn't drink. She asked him what happened. He told her the version with the jaw dislocation, and the hospital visits, and the surgery that didn't work. He left out the thing that crawled out of his wife's throat. 3 days later, the first body was found. A man named Harold Kessler, 62, retired, lived alone in a house on Birch Street, about a mile from Tom and Sarah's place. A neighbor called in a wellness check when Harold didn't pick up his newspaper for 2 days. The police found him in his kitchen. The official cause of death was exsanguination. The manner of death was homicide. The details, which Tom would learn later from a detective who came to ask him more questions about Sarah's disappearance, were these. Harold Kessler had been opened. Not stabbed, not slashed. Opened, the way you'd open a cabinet. A single incision running from the base of his throat to his navel, perfectly straight, so clean and precise that the medical examiner initially thought it had been done with a surgical instrument. The wound edges showed no tearing, no ragging. Whatever had cut him had done so with an exactness that no human hand with a kitchen knife could achieve. The incision had been pulled apart. The skin and muscle of the chest wall had been spread open and pinned back, not with medical instruments, but with what the ME described as localized thermal bonding. The tissue at the edges of the opening had been fused to the underlying ribs, melted and sealed in place, holding the cavity open like curtains pulled back from a window. The flesh had been cauterized where it met the bone, the contact points blackened and glossy, the surrounding skin blistered from the heat. Harold Kessler had been alive when this was done. The evidence was everywhere. Fingernail marks on the kitchen floor where he'd clawed at the linoleum. Bite marks on his own lower lip deep enough to sever the tissue. Burst blood vessels in his eyes from the pressure of screaming. He'd been pinned to the floor by something strong enough to hold a 200-pound man flat while his chest was being opened and his organs were being lifted out one by one. Harold Kessler's organs were gone. Not all of them. The heart, lungs, and liver were in place. But the stomach, intestines, kidneys, and spleen had been removed. Cleanly, completely, without damage to the surrounding structures. The blood vessels that had supplied them were cauterized shut, sealed with the same thermal precision that held the wound open. The mesentery, the membrane that holds the intestines in place, had been severed along its entire length with a single continuous cut. No hesitation marks, no exploratory incisions. Whatever had done this knew exactly where to cut. It had removed 30 feet of intestine without nicking a single adjacent structure. There was almost no blood in the cavity itself. The work was clean, meticulous, clinical in a way that was more disturbing than savagery would have been, because savagery is human, and this wasn't. The missing organs were found in the backyard, arranged in a line on the lawn, laid out in anatomical order: stomach, small intestine, large intestine, kidneys, spleen, as if for examination. They were undamaged. They had not been cut, bitten, or consumed. They had simply been removed and placed outside in a row. Each organ was positioned at precise intervals. the spacing consistent to the centimeter, like specimens in a museum display. The detective who told Tom this was watching his face for a reaction. Tom gave him one. Horror, confusion, the appropriate responses. Inside, he was thinking about the thing in his living room, the thing that had unfolded and stood up and turned toward him, the thing that had taken Sarah. 4 days after Harold Kessler, a second body. A woman named Maria Torres, 44, a nurse, found in her car in the parking lot of the hospital where she worked. Same incision, throat to navel, straight and clean. Same thermal bonding holding the wound open. Different organs taken this time. The heart was gone. The lungs were gone. They were found on the hood of the car, laid out symmetrically, one lung on each side of the heart, as if recreating their anatomical arrangement outside the body. Maria Torres had been alive when it started. The ME determined this from the bruising inside the wound, vitam bruising, the kind that only forms while the heart is still beating. She had been conscious, at least initially, while something opened her chest and removed her heart and placed it on the hood of her own car. The car's interior was undamaged, no blood on the seats, no signs of struggle inside the vehicle. She'd been taken out of the car, laid on the concrete floor of the parking garage, opened, and placed back in the driver's seat afterward. Her seatbelt had been refastened. Her hands had been placed on the steering wheel at 10 and 2. From a distance, she looked like a woman waiting for someone. You had to get close to see that her chest was a hollow cavity, with the ribs spread apart like fingers, and her shirt soaked through with a darkness that wasn't shadow. The security cameras in the parking garage had malfunctioned during the estimated time of death. Not broken, malfunctioned. The footage showed static, then a single frame of something tall and dark standing beside Maria's car, then static again. The single frame was blurry, distorted, but the shape was there. Vertical, angular, wrong. 3 days after Maria Torres, 2 more. A couple, Derek and Ann Voss, early 30s, found in their bed. They had been opened side by side, the same incision on each, the wounds facing each other as if the bodies had been arranged to mirror each other. Derek's intestines had been placed inside Ann's open cavity. Ann's had been placed inside Derek's. A swap. The organs were neatly positioned, tucked into the correct anatomical spaces, as if whoever had done this understood exactly where everything was supposed to go, and had simply switched the sets between the two bodies. The Voss couple had been positioned post-mortem with a care that the investigating officers found more disturbing than the mutilation itself. Their hands had been joined between the two bodies, Derek's right hand holding Ann's left, fingers interlaced, resting on the mattress between them. Their heads were turned toward each other on the pillows. Their eyes had been closed. They looked peaceful. They looked like a couple sleeping, except for the fact that their torsos were open cavities, filled with each other's organs, and the sheets beneath them were saturated with so much blood that it had soaked through the mattress and pooled on the floor underneath the bed frame. Their 3-year-old daughter was found in her room down the hall, unharmed, asleep. She had not woken up during any of it. The door to her room was closed, and there was a thin line of the dark residue along the threshold, as if something had sealed it. Tom read about the Voss couple in the news. He was sitting at his mother's kitchen table, and the article was on his phone, and he read it twice, and then he went to the bathroom and vomited. Because he understood now. The thing wasn't killing randomly, and it wasn't killing for pleasure. It was studying. Harold Kessler, removal and examination. Maria Torres, extraction of specific organs, arranged for observation. The Voss couple, transplantation, or the attempt at it. It was learning how human bodies worked. It was taking them apart the way a child takes apart a clock. Carefully, methodically, trying to understand the mechanism. It was learning, and it was getting better at it. The detective came back. Different questions this time. Not about Sarah, about the murders. Had Tom noticed anything unusual in the neighborhood? Had Sarah mentioned anything about the victims? Did he know Harold Kessler, Maria Torres, the Voss couple? No, 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 no. But also yes. Because the residue on his living room carpet, the stain left by the thing that had stood there after climbing out of his wife, matched a substance found at all 3 crime scenes. A thin, dark film on the floor near each body. Same unknown organic compound. The police hadn't connected the scenes yet, but they would. The substance was distinctive. It would link the murders to each other and to Tom's house. And then the questions would stop being about what Tom had noticed and start being about what Tom had done. He thought about running, packing the kids into the car and driving until the gas ran out. But running would make him look guilty, and he wasn't guilty. And more importantly, running wouldn't stop the thing. It was out there. It was studying. And whatever it was building toward, whatever final understanding it was assembling from the disassembled bodies of the people it was taking apart, it wasn't finished. The 5th body broke the pattern. A man named Curtis Webb, 55, found in a parking garage downtown. Same incision, same thermal bonding. But this time, nothing had been removed. Instead, something had been put in. The ME found an object inside Curtis Webb's abdominal cavity. Small, dark, angular, roughly 2 centimeters, lodged between the stomach and the liver, nestled into the omentum like an egg in a nest. It was warm to the touch, measurably warmer than the surrounding tissue, maintaining its own temperature independently of the body. It was vibrating, a constant, steady pulse, barely perceptible, that the ME initially mistook for her own heartbeat in her fingertips. She realized it wasn't hers when she set the specimen down, and it continued vibrating on the steel tray, producing a faint ringing tone that filled the autopsy suite like a tuning fork. Curtis Webb had been alive for this procedure too. The vitum bruising was present. But unlike the others, his face was different. His expression, fixed by rigor mortis into whatever it had been at the moment of death, was not pain or terror. It was something closer to calm. His eyes were closed. His hands were at his sides, relaxed, palms up. He looked like a man who had stopped fighting, who had accepted something. The ME noted in her report that the positioning suggested cooperation, or at least the absence of resistance, though she couldn't explain why a conscious man being cut open would stop struggling. It was identical, in every measurable way, to the biopsied sample from Sarah's esophagus. The ME removed it and placed it in a specimen container. It continued to vibrate. Over the next 12 hours, under observation in the hospital pathology lab, it grew. By morning it was 3 centimeters. The lab tech who measured it noticed that the container it was in had developed a crack, a hairline fracture radiating outward from the point where the object was touching the plastic. The object was transferred to a glass container. It cracked the glass within 6 hours. They put it in a steel tray. It sat there, vibrating, growing, and the sound it made was exactly the sound Tom had heard in his living room. The low, subaudible hum of something powering up. Tom learned about the Curtis Webb case from the news. He learned about the object from Petrov, who called him because the pathology lab had contacted Petrov when they realized the implanted object matched the biopsy from Sarah's throat. Petrov was careful, clinical, but Tom could hear the edge in his voice, the edge of a man encountering something that his 30 years of medical practice had not prepared him for. The object in Webb's abdomen is growing at the same rate as the mass in Sarah's esophagus, Petrov said. 4 millimeters per day. If the pattern holds, it will reach a viable size within 2 to 3 weeks. Viable for what? For the same thing that happened to Sarah. Tom hung up the phone. He sat at his mother's kitchen table with his hands flat on the surface, and he thought about what Petrov had just told him. The thing was reproducing. It had studied human anatomy, taken people apart, examined the components, learned how the machinery worked, and now it was planting seeds. Curtis Webb was the first. There would be more. He went to the police. He told them everything. The jaw dislocations, the CT scan, the failed surgery, the thing emerging from Sarah's throat, the unfolding, the residue on the carpet. He told them calmly, clearly, with as much detail as he could remember. The detective listened without interrupting. When Tom finished, the detective was quiet for a long time. They didn't believe him. Of course they didn't. They thanked him for coming in, and they suggested he speak with someone, a counselor, a therapist. They said the stress of Sarah's disappearance might be affecting his perception. They were kind about it in the way that people are kind to someone they think is having a breakdown. Tom went home. Not to his mother's house, to his own house, the house where it had happened. He sat in the living room and looked at the recliner, still stained with Sarah's blood. He looked at the oval stain on the carpet. He sat there for a long time. The hum started at sundown. Faint. So faint that Tom thought he was imagining it. The residual memory of the sound, playing back in his traumatized brain. But it got louder. Slowly, incrementally, the way a tone builds when someone is turning a dial. It was coming from the stain on the carpet. Tom got up and walked to the stain and stood over it. The carpet fibers around the oval were standing upright, vibrating, each one trembling at a frequency too fast to see but visible in the blur of their movement. The stain itself was darker than it had been. Thicker, wetter, as if fresh fluid was seeping up from the carpet pad underneath. Something was pushing up through the floor. The carpet bulged, a small, precise dome, rising from the center of the stain, the fibers stretching upward over a shape that was hard and angular and familiar. Tom watched it rise, 1 inch, 2 inches, the carpet fibers splitting as the shape pushed through, and then the tip of the thing broke through the surface, and it was dark and wet and faceted, and it was the same material, the same geometry, the same light-absorbing darkness. It was growing out of the floor, out of the residue that the first one had left behind. A new one. Tom backed away. He backed all the way to the front door and put his hand on the knob and stopped. Because behind him, in the living room, a small piece of something impossible was pushing its way into his house, and in a hospital pathology lab across town, another piece was growing in a steel tray. And in Curtis Webb's body a seed had been planted, and maybe in other bodies too, other victims he didn't know about yet. And the thing that had come out of Sarah was somewhere in the city with its dark, featureless head, and its angular body, and its meticulous surgical hands, opening people up and putting pieces of itself inside them, and Sarah. Sarah was with it, or inside it, or part of it. Her body had been the passage, the doorway. It had grown inside her and used her to enter the world, and she had told him to run, and he had run, and now she was gone, and the thing was everywhere and multiplying. Tom opened the door. The night air was cool. The street was quiet. The houses were dark, normal, sleeping, unaware. He walked to his car. He got in. He started the engine. He drove to his mother's house. He walked inside. His children were asleep in the guest room. Jake on the bed, Lily on the air mattress, their faces slack and peaceful in the way that only sleeping children's faces are. He sat on the floor between them, and he listened to them breathe, and he tried not to think about the thing growing out of his living room floor, or the thing growing in the lab, or the things that might already be growing inside people who didn't know yet. People who would wake up one morning with a sore jaw, and a pressure in their throat, and a feeling that something was pushing up from inside. He sat there until morning. When Lily woke up, she looked at him and smiled and said, "Hi, Daddy." "Hi, baby. Is Mommy coming home today?" Tom looked at his daughter. He looked at her small, perfect face, and her small, perfect mouth and her throat, her thin, pale, unmarked throat. "Soon," he said. "She'll be home soon." He didn't know if that was a lie. He didn't know what home meant anymore, or what soon meant, or what any of the words meant that people use to describe a world where things make sense and bodies stay closed, and the worst thing that happens to you is a dislocated jaw that a doctor can fix with his thumbs. Outside in the morning light, a woman was walking her dog on the sidewalk. She stopped, put her hand to her throat, and swallowed hard, just once, like something was sitting wrong. She tilted her head, rubbed the side of her jaw, frowned. Then she shook it off and kept walking. The dog trotted beside her, oblivious. Down the street, a man getting into his car for his morning commute paused with his hand on the door. He worked his jaw side to side, opened his mouth wide, testing, closed it, opened it again. He stood there for a few seconds, mouth open, fingers pressing against the joint just below his ear, feeling for something he couldn't name. Then he got in the car and drove away. At the bus stop on the corner, a teenage girl coughed once, hard, and pressed her hand to her throat. She swallowed. She swallowed again. She looked uncomfortable for a moment, confused, distracted. And then the bus came and she got on and was gone. Tom watched them through the window. He watched the street fill with people leaving their houses, starting their cars, walking to the bus stop. Normal people on a normal morning. He watched their throats. He watched their jaws. The hum was everywhere now. He could feel it in the floor, in the walls, in the glass under his fingertips. Faint, patient, growing.